All right. Well, thanks for coming to round two. I thought I'd open up today to just talk about a little conversation that I had at the Becker's Healthcare Conference, which was held in Chicago just 2 weeks ago. And I was at the coffee bar speaking to an individual who was the head of their rev cycle management department. And we were talking about like the top three pressing things that healthcare delivery organizations were facing. So clearly, workforce was one of the big issues. And then the second thing we talked about was access to care. But then the third thing we talked about was the AI wars between payers and providers. And we talked about how electronic health record systems are becoming more sophisticated in gathering clinical data in order to support prior authorizations. But on the flip side, there's been some questionable submissions on the payer side as far as whether or not the clinical data that's being submitted actually supports. And by right, the payer should know whether or not a prior authorization has supporting medical evidence and clinical evidence before you're paying for a service that's being delivered. So just by show of hands, is everyone in the audience today part of a payer organization, or are you a mix, payer? Most are from payer organizations? Okay, well, you all then recognize that prior authorization, it's one of the highest friction and most costly problems at health plans today. In fact, those clinical reviewers, you're spending hundreds of thousands of dollars on those clinical reviewers to really find those 2 or 3 lines of evidence in an actual patient's clinical chart to support a prior authorization request. And that's a lot of manpower, and let's face it, there's not a lot of nurses or clinical reviewers out there that are available to help support this process. For those of you that are not familiar with prior authorizations, they're embedded in medical evidence, right? I mean, the policies they're basically medical policies, and they're embedded in clinical evidence to say that if you have these things, this is the treatment that you should receive. And so, by rights, payer organizations should request the associated medical clinical data to support the prior authorization for approval. So I hope not to disappoint, but today's demo is going to be very similar if you participated in the earlier session to the demo that I did earlier, but relative to a different use case. We are going to talk about requests submitted for prior authorizations and then get a little deeper into medical record abstractation using SAS document analysis for health records. I actually have a couple of individuals in the audience today. Greg Massey, who I mentioned earlier in the earlier session, is with us, and he is definitely your expert on SAS document analysis for health record, as well as I have Pratesh. He's also one of our technical experts that can definitely field questions not only on SAS document analysis for health records, but also on retrieval augmented management. So similar to before, we're going to talk about that data extraction. We're going to talk about using intelligent decisioning to match the member to the provider to the policy to make sure that it's a match. And then we're going to talk about extracting the policy criteria from those prior authorizations so that we can align the clinical data to the policy to ensure that it meets the requirements for that prior authorization, so you can feel confident that you're paying out on or that you're approving a submission. Finally, we'll look at similarly the workflow, which involves a human in the loop, where an individual, that clinical reviewer, could actually be alerted to which prior authorizations may be missing data, which prior authorizations have associated data, and where it could actually be found in the tagged clinical chart. So let's go ahead and get started. So the first step after a prior auth has been submitted is to conduct that abstractation of the submitted medical record or the clinical document. Now I know that the example that I'm showing here is an actual bill, but I think it's meant to really just give you an idea of how this actually works. It's a multi-step process. Not only do we, in order to abstract the data, want to be able to apply optical character recognition to extract the textual pieces of content from a PDF medical record, but we also want to be able to apply natural language processing models to it so that we can, with certainty, understand deterministically that the data that we are abstracting from that clinical document is accurate. And it really is just one model, but it's thousands of lines of code that have been developed to really understand the context around the data which is actually contained in the medical record documents. So let's shift our focus now onto the medical policy, which contains the criteria for we want to evaluate the evidence that we just abstracted to. So here's where we activate another component of the SaaS platform. It's called intelligent decisioning. And we're setting up pipelines or workflows here to actually match that prior authorization, so what is the medical procedure for, to the actual medical policy itself, along with the provider and along with the actual patient. So for example, if we had a prior authorization come across for a total knee replacement, which is our example today, we're going to abstract the clinical data from the medical record using SAS document analysis for health records, but then we also want to be sure that we're pulling the appropriate medical policy to align or compare that data to understand if it meets those inclusion or exclusion criteria. We need to validate that the policy itself is the correct version as well. So we talked about that earlier in the session about how medical policies change all the time. Evidence changes all the time. And so intelligent decisioning is utilized to make sure that the most recent policy matches the actual prior authorization submission request that came through. Now let's discuss how we actually capture the criteria contained within the medical policy itself. Once all those aforementioned checks are complete to map the prior authorization to the actual medical policy, which includes the doctor and the patient name, the prior authorization flows into SAS Retrieval Agent Manager, or RAM. And RAM allows for that configuration of the Govern AI agent, which captures all the criteria in the policy in context. So for each request, the agent in this case extracts the criteria for approval from the policy, including every single requirement and every single exclusion. It evaluates that clinical evidence extracted from the patient's medical record in comparison to the criteria in the policy. So the visualization that you're seeing right here on the left, this is an example of the medical record, the clinical evidence, right? And you can actually see where it's actually bookmarks, where we're bookmarking the clinical evidence as it relates to the indications or the policy for prior authorization approval, which is visualized on the right of my screen. So here's the example of that prior authorization agent at work, RAM at work, where we're actually comparing the clinical data or that medical evidence that's in the medical record in comparison to the policy criteria. So I'm going to have you just have a look at that so you can see the comparison, and you'll also see annotated where the actual evidence exists, on what page exists, and the context which surrounds it. So that's great, but what about the clinical reviewer experience? The dashboard you see here, similarly to the clinical decision support dashboard you saw earlier in the demo today, is really that entry point for that clinical reviewer, that nurse that's scanning, that traditionally was scanning through pages and pages, probably hundreds of pages of the medical record to try to find those 2 or 3 sentences. But you can see clearly that the visualization that we've built allows that clinical reviewer an easy to navigate dashboard to understand when requests were submitted, the patient and the procedure requested, the assigned policy, including the prior authorization number, but importantly, how many of those have been actually flagged that need review, or how many of those have actually been auto-approved. So the left-hand side of the screen is showing that toolbar on how many were flagged for review versus how many were awaiting approval in the workflow, etc. But we're going to look at a specific example for Karen Miles, who was actually had a prior authorization request submitted for a right knee replacement. So as a clinical reviewer, I want to be able to go back and see how the decision for Karen Miles' total knee replacement was actually auto-approved. I want to validate it for myself. So after double-clicking on Karen's name, I'm presented with her prior authorization checklist. So on the left, you can see that her basic demographic and procedural information, and I can actually navigate to view submitted documentation, which is in the bottom left-hand corner of the screen, to access her medical record, which has been bookmarked by SAS Document Analysis for Health Records, to find that location in that 100-page document, which supports the criteria for the medical procedure to be approved. You can see clearly, too, which of the criteria have been met versus which of the criteria haven't been met. So let me go ahead and just simulate like I actually wanted to look at the associated medical evidence that supported the prior authorization to auto-approve Karen Miles for her total knee replacement. Now specifically, she had to have shown a certain level of arthritis in her particular joint for that left knee replacement, and it's highlighted, I just highlighted it in the screenshot here in yellow for you. But you can clearly see how I was able to quickly link out to the associated medical record to actually access the piece of information that supports that one criterion that was a part of the medical policy or the prior authorization. So you might be thinking, where has this been implemented before? Because the use case that I presented earlier around clinical decision support was a prototype. Well, I'm happy to report that this is actually a live deployment that we have. The client that we are working with prefers that we did not use their name, but it's a large health insurer, and they had worked with us on deploying SAS Document Analysis for Health Record, and they were receiving a significant amount of high volume of unstructured documents. And just a few statistics here that I wanted to share with you to show you the power of this is they were processing between 5 to 10 million pages of scanned medical records every single night. So they estimated that they would need to hire about 350 to 400 registered nurses to match that throughput of the 5 to 10 million pages a night to review those every single night if they didn't have AI to help them with this problem. So they implemented the solution, and they're bookmarking and processing 15 million pages every night, which is a drastic improvement over their previous manual process. And they're estimating that they are saving about 300 manpower hours of or 300 to 400 registered nurses on an annual basis to help with this particular problem. So in summary, similar to the demonstration earlier, it's the same process, the same technology, but applied to a different problem, a different use case, and in this case, prior authorization approvals. We discussed the workflow where those prior authorization requests are coming into payer organizations, typically the payers are receiving those submissions with associated scanned PDF documents. In the case of our case study, millions of pages a night, and we're actually doing some medical record abstracting using SAS document analysis for health records. Then we've applied intelligent decisioning to make sure that the member, the policy, the provider all match with the prior authorization requests that are coming in. And then we're using retrieval augmented management to really vectorize or abstract the criteria from that policy and align it to the actual clinical data that is submitted as part of the prior authorization, that medical record that came in. And then finally, those dashboards for those end users, those clinicians, they're easily able to look at those dashboards and be able to distinguish which criterion are met or not met for a prior authorization, and they can link out to that bookmark PDF document to be able to view for themselves the actual documentation in support of the prior authorization. So that is the end of this presentation, but more than happy to take questions. And again, I have two amazing resources with me today that can get to a level of technical depth with you all if you need support for my support in answering a question here today.